In this section, we will discuss tachy and bradyarrhythmias, the mechanisms and examples. Firstly, we will look at tachyarrhythmias. Before we go into different examples, perhaps we should clarify some terms describing tachycardias. For paroxysmal, we usually means this ectopic focus, sudden onset, and abrupt cessation. When we describe an arrhythmia as recurrent, we mean it occurs periodically, and periods of no tachycardia are longer than periods of tachycardia. Non-sustained usually means at least 3 or at least 6 beats, and usually is less than 30 seconds, and it spontaneously terminates. For sustained tachycardia, we usually mean it's a duration of more than 30 seconds, or requires intervention to terminate the arrhythmia. Incessant means long periods of tachycardia and short periods of normal sinus rhythm. Monomorphic refers to morphology. It comes from a single focus, and the complexes are similar with equal intervals. For polymorphic, there are multiple foci, and the complexes appear different with varied intervals. And SVT means supraventricular tachycardias, as the name implies, the tachycardia originating from above the ventricles. So this is a normal sinus rhythm. The focus is from the sinus node. As we said before, the rate is usually 60 to 100 beats per minute when we are at rest. So this is the SA node, AV node, and it derives to sinus rhythm. Tachyarrhythmia classifications has many kinds. This is one type of classification based on disorder. So it can either from impulse formation disorders or from impulse conduction disorders.